And I want to make sure that as a county, we have a functioning healthcare. And part of it is having good facilities with human resource, equipment, and patients who are well taken care of. One of my big things was on the morale of healthcare workers across the county. And part of it was the fact that many have been on contract for a long time, and they have been wishing or wanting to make sure that they become permanent and pensionable. So those were some of the things that I was looking into, because I do believe that whatever campaign promises I made, I did not make them in vain, or I did not make them just to get elected into office, but really with the intention of streamlining those sorts of areas. So what we shall be doing is we are going to look into, we are going to have an ad hoc committee that will help us with the process. I can immediately confirm that as far as the promotions for healthcare workers that are due, within the next 60 days, we shall be able to handle that. In addition to that, one of my other big things was to make sure that many of the families, or most of our households in Nakuru County, have NHIF, because that is the only way that we'll be able to make sure we have a very healthy population, because when they need medical help or medical attention, then they are able to access it using the NHIF. Because as of right now, you find that there's too many households where they need treatment, where there is medical issues, but they are not able to access treatment. So that will be a part, or a big part, of what we shall be doing going forward. We had identified a few groups that we would start with, and part of those are those living with disability, those with disability. In addition to that is those over 65 years old, where the county would be catering for that, for the 6,000 per year for the NHIF. And in addition to that, the vulnerable, the ones who are completely not able. So we'll do it that way, and then as we go along over time, then bring in more people into that. But initially, those would be the groups that we would be starting with. Is I have found that there is quite a few patients who are here in the hospital, some for months. They completed the treatment, or treatment was completed, but they were unable, they could not be discharged because they were unable to raise the money to pay for the treatment. We have sat down with Dr. Aisha and her team and the waiver committee, and I have been able to have, or to do a waiver for almost about 5 million shillings at this hospital, so that over 64 patients will be released, and some are little children. I just met a 7-year-old boy who had a fracture, but has since been taken care of, but has not been able to go home and is just laying in the bed. I've also met an older gentleman who had an accident, and he says his treatment took 2 months, but he's been here another extra month because he has been unable to raise the fees required. In addition to that, I have also discovered or found out that there is bodies that are laying at the mortuary that their loved ones have not been able to get them because they were unable to raise the money that was required to be paid, because some maybe were passed away while at ICU. So the family was unable to raise the money, so the bodies have been lying at the mortuary. So what we have done is, with immediate effect, we have said that those bodies be released to the families so that they can bury them with dignity.